Welcome to the Beyond Physio podcast. I'm Dr. David Kwan.
I'm Dr. Alex Geisbühler.
And today we're going to talk about some low back pain myths. And I would say low back pain is probably the most common diagnosis across the board for physical therapists in general and probably for us as well.
Mm-hmm. I think there's some statistic rolling out there that's anywhere from like 69 to 80% of patients have some sort of lower back pain, but perhaps not necessarily caused with their lower back, but some sort of like pain originating in their back and their hips and spine.
Yeah, and it's like the number one thing that limits people from going to work. It's the number one thing that limits people in terms of their everyday life. It's also something personal to me. I've had low back pain. I actually had surgery in my back at one point in time, and happy to say I'm 100%.
Yeah, fantastic. Yeah, and I too. I have two herniated discs in my lower back, this gives us the option or that opportunity to really empathize with some patients coming in who have lower back pain because we both lived through it.
Yeah, no, it's terrible. It's debilitating, and it's something that really there's a lot of false information out there about it. So how about we dive in? So today's topic is myths and misinformation in regards to low back pain. So you want to talk about the first one?
Sure. So something that I hear a lot in the clinic and then also patients coming in is that they have some sort of instability in their back or frailty in their back. And sometimes they hear this from their doctors saying like, oh, watch what you do because your back is a very delicate structure. Mm-hmm. When the reality is it's actually a very supported and structurally sound, component of our body that's built for load disbursement and to translate load through the rest of our extremities.
Yeah, I mean, I think that ties into another thing in terms of like fragility, right? I think there's research, I don't think there is research that goes to show that if you are afraid to move, your outcomes in terms of your low back pain are much worse.
Absolutely.
So people, they get put on bed rest or they stop moving, they stop going to the gym, they stop walking, they stop doing a lot of different things. And you're not a fragile flower. You're not going to break if you do the wrong thing. If you have a history of back pain and you've been told that you're very unstable and you have to protect it. I mean, there are some diagnoses where you do have to be careful in terms of things breaking, like say you have a compression fracture or you have a spondylolisthesis, which is basically like your vertebrae slips forward. But even those diagnoses, like it's very unlikely that your whole back is going to fall apart if you do one thing wrong.
Absolutely. And then also, like you said, even with a spondylolisthesis, depending on the severity, bed rest used to be the prescribed activity, I guess, or no activity whatsoever. And now we realize that that's one of the worst things you can do.
Yeah, one of the worst things.
Yeah.
And that kind of goes into one of the other myths, which is that like deadlifting is terrible for your back because
Sure.
your deadlifting is just bad. And that's a myth. Deadlifting at the wrong time is a myth, is bad. Deadlifting the wrong weight when you're not ready for it is bad. Deadlifting with improper form is also bad. But there's a lot of different contexts in which a deadlift will look different and you're going to have different form for it. But to say a blanket statement like deadlifting is terrible for you is just flat out wrong.
Right, and that's a functional movement that we actually have to do day
All the
in
time.
and day out. If you drop a pen on the floor and you pick the pen up, that's a deadlift.
Yeah.
But that goes to what you're talking about. Like that's a very light load as compared to maybe a heavier load. And when your body's not adapted to it, I think that's really what people kind of miss or gets glossed over when people said deadlifting is bad. It's whatever your body has been adapted for and strengthened. So actually performing deadlifts will bulletproof or, strengthen the structures that are required so that you can do those activities safely.
Yeah. And this ties into something that we've talked about before in terms of resiliency. Like, how do you build resiliency, right? How do you build resiliency in anything that we do? Like, we have to test it. We have to push it. We have to strain it. We have to stress those structures out a little bit in a way that's planned and kind of stepwise, or else, you're never going to be able to build resiliency, be able to tolerate more load, tolerate more stress to the joint. And deadlifting is a great exercise. I have most of my back pain patients deadlifting at some point, and depending on their point of rehab, like their weight might be different, but deadlifting is not bad for you.
Yeah.
Facts.
Facts. Which might lead into our next myth, which might be like I've heard, hamstring tightness causes back pain.
Yeah. My back hurts because my hamstrings are too tight. And although hamstring tightness could play into it, it could be a symptom. Actually, spinal fractures I've seen with a bunch of patients in the past, especially adolescent kids, not adolescent kids, but teenage kids. When they present with a sudden loss of hamstring mobility, it a lot of times is a sign that they have a spinal fracture. But if you just throughout your entire life you've had tight hamstrings and you just so happen to also have back pain, they're not causational. Like, that's not, there's a lot of people out there that have really tight hamstrings that don't have low back pain, and there's a lot of people out there that have really loose hamstrings that do have low back pain. So your tight hamstrings aren't necessarily the thing that's causing your back pain.
Absolutely. So the hamstrings, for those of us who are not really quite sure where they connect on the lower part of your pelvis and all the way past your knee. So they cause some knee flexion and some rotation in those hips. Now, of course, our spine, and if we're thinking about lower back pain specifically, is very intimately connected with where our pelvis is moving. So yes, like you said, hamstring tightness can play a part of it, or can be a product of something else that's happening in the spine and the pelvis.
Yeah, and people think like a tight muscle is a strong muscle.
Yeah.
So a lot of times with my patients that have tight hamstrings, it's actually not that their hamstrings are tight, but their hamstrings are maladapted or poorly positioned, right? So Gianna, can you throw me that pen? The dry erase pen? So I'm going to draw some stuff for you. If you guys are listening on Spotify, you guys could also watch this video on Instagram or on YouTube. But this is very rudimentary explanation of like how the hamstrings tie into your pelvis and how it ties into your low back. All right. So if you think of a seesaw, I'm going to draw a very crude picture. I'm not the artist here. But imagine that this is your pelvis. Okay? This is a side view, okay? And then this is your low back. I don't want to mess up the drawing that we have. This is your low back. And that's your thoracic spine. This is your hip, your knee, your feet. All right? So proportions are a little bit off. But in terms of a side view, you have different structures that attach to your pelvis, okay? So you got your hamstrings over here that attach the hammies, right? And then over here we got hip flexors and your quad, right? Quads. And then over here you have your anterior abdominals which attach to your ribs as well. Okay, and then you got your low back muscles that come up like here. So this is low back and abs. All right, some of you guys might know what abs are. So in terms of the hamstrings, if you look at this kind of like a seesaw, right, you could see how on this pivot point you could either go up or you could go down. And you could go up on this side or down, just like if you were a kid sitting on a seesaw. If one side is heavier, it's going to go down, and one side is lighter, it's going to go up. So, especially with the hamstrings, if your hamstrings always feel tight, it might be because your pelvis is tipped up this way and is putting more pressure and tension along your hamstrings, right? So say if you set a certain length of hamstring, and then I'm exaggerating these things. So you see how on this picture we have an exaggerated lordosis. The pelvis is kind of tipped forward, and the hamstrings are lengthened along the posterior side of the back of the thighs. And what that does, it gives you the sensation that it's really tight because it's always being stretched. And if it's always being stretched, it's going to feel tight. Also, an overly stretched muscle is generally speaking a weak muscle. If you were to try to pick up something off the floor with your arm, you wouldn't pick it up and say it was really heavy. You wouldn't pick it up with a straight arm. You'd bend your elbow a little bit because there's something called length-tension relationships in muscle, and there's an optimal length in terms of like how much bend in the joint there should be in order to release some of that tension through the muscle, right? So tight hamstrings might not be causing your low back pain. Your hamstrings might be tight because of your low back pain, right? Because of the position of your pelvis, which is also going to increase some lordotic curvature at your low back and also make your low back muscles like super, super tight. So all these things kind of interplay and tie into low back pain, but hamstring tightness in and of itself could be more of a symptom than actually a cause.
Mm-hmm. And you spoke about that where length tension relationships or passive insufficiency, where the muscle is stretched over so far that it actually doesn't work optimally. Yeah. And this goes into these diagrams work perfect for our next myth, which I think people, like, you hear it all the time, like, oh, you have lower back pain, you got to work on your core. You got to tighten your core. You got to strengthen that core. Now, core is such a broad term that's been thrown out, but I think when people say like you got to tighten your core, they're really talking about the abdominals. And you've kind of shown how if we are in that anterior pelvic tilt, you can see how those anterior abdominals are stretched out.
Yep.
But you and I know that the anterior abs or that rectus abdominis, which is like the six-pack that everyone knows, is not the only abs to worry about, and definitely not the most important abs.
The only abs that people care about.
Right, of course. Yeah. Yeah. And it's very possible that someone can have ripped six-pack, but have a very weak core.
Absolutely.
Yeah.
So, like, what is the core, right? And how do we strengthen it? The latter is probably a pretty loaded question. We could probably do a whole podcast just on, like, how do you actually activate the core. But core muscles are not only the rectus abdominis, which is like the six-pack muscles, but you have external internal obliques, you have your transversus abdominis, a bunch of names that sound Greek and like Harry Potter spells.
Yeah.
But it's more than just that. Also, there's muscles in between the vertebrae in your spine, like in your back, and that have a large effect on what we call like spinal stability. Mm-hmm. But we don't necessarily know how to work out. Like, people know how to do crunches and planks and stuff like that, but people don't know how to activate their rotatories or...
Right. So those rotatories or the multifidi, those are the ones that create that stability in the spine. And so when we're talking about lower back pain and creating that stability in the spine, and this is not to talk about that your back is that frail thing that we spoke about with the instability, but rather keeping it structurally sound when external forces are on you. So a lot of leg lifts, crunches, sit-ups, that's all flexion and extension moving the spine.
Mm-hmm.
We also have to learn how to keep the spine still
Yes.
with external forces on top of it.
Which is what stability is.
There it is. Yeah.
People throw out those terms like stability, stability, stability. Stability is basically being able to not move. Like not being moved by outside perturbations,
Mm-hmm.
right? And one great way, deadlifts.
Yeah. Deadlifts are fantastic. You have to keep your spine in a neutral position.
Mm-hmm.
Despite the amount of load that you're lifting.
Yeah, and you're just moving your pelvis. It's a great stability exercise, whatever that means.
Mm-hmm.
Right? Yeah, another myth is that it's just going to go away on its own. That you don't have to worry about it. Everybody has back pain. Pop some Advil and go about your day. And everything is on a spectrum, right? You could have really, really bad back pain where you're like immobilized. And you could have kind of low-level back pain that you get every now and then and kind of goes away if you sit too long or whatever. But low back pain, although it's extremely common, it's not normal. And it's actually a signal from your body that something is wrong. You're either doing too much of something, you're malpositioned, you're not strong enough in the right ways, but it's a signal that there is something going on. And if you just ignore it, and you don't address it, a lot of times it could become like a snowball that kind of snowballs.
Yeah.
That actually happened with me,
Mm-hmm.
right? I've had low-level back pain from when I was like in junior high to high school, and then I always had some of these issues, and then especially when I was training, I'd tweak my back and have issues with it, and I would ignore it and it would go away. And then when I went in grad school, I knew a little bit better. So we started treating some of these things. But, when you're in the midst of training for something specific, I was like really heavily training in Spartan races
Mm-hmm.
and doing really, really well with it. And then I went through a powerlifting block and I wanted to get really, really strong. And I kind of ignored the pain while it was happening. And
Push through the pain.
It just took one... That was a bad snap. It just took one bad lift when I was a little bit too tired and a little bit dehydrated. It was too early in the morning and...
Just the perfect storm.
It was a perfect storm. And whatever I had brewing under there became a problem that I dealt with for basically 2.5 years.
Mm-hmm.
And ultimately ended up me having to get surgery after 4 epidurals and physical therapy and acupuncture and everything under the sun, medications and ultimately I did have to get surgery. And we also have to understand that spectrum and that pendulum could swing both ways. Like there's a lot of patients that I see that don't need surgery and are told by people that they need surgery.
Mm-hmm.
I also have seen the other way where, people come in for physical therapy and I tell them straight up, hey, I've actually had a patient recently. I told him, honestly, you've been dealing with this for 4 years.
Mm-hmm.
You presenting with all these symptoms, you're incapacitated by pain. Like, you need to go talk to a surgeon. After surgery, he came back and did rehab with me and he was super, super thankful because I'm the only one that was honest with him.
Mm-hmm.
I was the only physical therapist that said, hey man, like, to be honest, I can't really help you. And he got the surgery and now he's 100%. After 4 years of struggling with this issue.
And we both know years and years of pain leads to what we were talking about, fear avoidance behaviors, where you're now afraid to do certain things. I can't sit up out of bed. I can't sit for too long. And that's going to cause a cascade of different things. For over 4 years,
Absolutely.
That's a long time. All these muscles are probably all sorts of distorted and messed up. Because of the compensations that you have to do for lower back pain.
And just weakness. Like, it's true. Like, if you don't use it, you lose it.
Absolutely.
And as the 40-year-old virgin says, if you don't use it, you lose it. And especially when you're in pain, you actually have biological mechanisms that down-regulate or shut down muscles on purpose.
Mm-hmm.
So if you're dealing with years and years and years of pain and struggle, even if it's like on and off and on and off, you really need to seek help. Like, you need to pay attention to it.
Yeah. And that also leads to this other myth that I've heard where people will, like you said, it's possibly years of a snowballing effect where a domino is falling to another domino to another, leading to weakness or some sort of incongruence of what's going on in the joint that leads to either a disc herniation or a back pain or something like that. And people will say like, well, I felt totally fine, and then I reached for the remote and it went out, or I had a massage and all of a sudden I couldn't get up off the bed, or I went to yoga. And people say like, so I'm never going back to yoga, or I'm not gonna, the remote, I can't reach down for things. I need to get other people to reach for the remote. When the reality is that was the straw that broke the camel's back.
Yeah.
A sneeze, a hiccup, a cough would have done it.
Yeah.
It just happened to be that one object or instance at the time, but it had been leading up for years, months, etc., up until that point, and then that's when the disc herniated or a nerve got impinged. And we know that like if I think there was a study where they took 100 people without lower back pain, no pain whatsoever, and had them go through an MRI, and 80% of those people without pain showed some sort of disc degeneration, bulge disc, herniated disc, nerve entrapment, etc. But these people had no pain. So that in and of itself doesn't necessarily mean that there's pain or instability in your back. However, when something is pushing on your nerve and causing back pain, you definitely know about it.
Yeah, absolutely. Yeah, I mean, you could take any one of our X-rays or MRIs, and you're gonna see some stuff. Especially if you're the age of 50, you're gonna see some stuff. But if you are not in pain, that's great. It doesn't mean that you should ignore anything that you have in your back, but just knowing that MRIs and X-rays aren't the end-all be-all to tell you like definitively this is exactly what's wrong. I've had people that have multiple bulging discs, multiple stress reactions in their spine, facet joint dysfunctions, arthritis, and their back pain wasn't because of that.
Yeah.
Their back pain was actually because the way they were positioned and the way that they're honestly breathing and the way that they were doing a lot of things that was causing their back pain. And once we were able to correct those things, a lot of their symptoms improved. So MRIs, X-rays, they're good to give us some information, but that information in and of itself isn't going to be definitive.
Not the be-all, end-all.
Mm-hmm.
Yeah.
Awesome. So I think that's going to be it for today. We could do another series.
Yeah, absolutely.
And we probably will. If you guys have any questions or concerns, leave a comment in the comment section, and we'll see you guys next time.